Hi, I'm Dr. Amy Acker. I'm a general pediatrician at the Kingston Health Sciences Centre. I'm here today to answer top 5 questions for parents going into this respiratory season. A question we get a lot from parents is what's the difference between RSV, the flu, COVID-19, or other respiratory viruses? And the truth is, there's not a lot of difference. They all have respiratory symptoms. Sometimes RSV affects babies more. They may have some breathing difficulties and a wheeze, which is a high-pitched breathing out sound. The flu or influenza tends to come really fast and may also have muscle aches, high fever, GI symptoms. COVID-19, now with many kids having had the vaccine or having natural immunity from having had the infection, is often just like a regular respiratory virus. So the treatment for all is the same. There's no antibiotics for a virus, so it's just supportive care. Watching hydration, monitoring for infection and treating infection, and giving your kids extra TLC. The next question we get a lot is, how do I keep these viruses out of my home? Unfortunately, viruses are a natural part of life, so they're going to come into your home through the fall and winter. The biggest thing that we can do is hand wash, hand wash, hand wash. We can try to teach our kids to cough into their arm or into their shoulder, just not their hands. And super important would be to keep up on the regular vaccines, get the annual flu shot, and keep up with the COVID-19 boosters. Another question is, what's the best way to treat a fever? I think of a fever as a good sign. It's your body's way of showing that it's fighting off a germ. It's always okay to use acetaminophen, which is Tylenol or Tempra at any age, or ibuprofen, which is Motrin or Advil for any kids above 6 months to help lower their temperature. It's important to note this may not totally bring their temperature to normal, but may decrease it by a few degrees. Hydration is the next important thing. So we want to make sure kids are still drinking, and so that they're having at least 3 Ps in 24 hours. Most kids won't feel like eating when they have a fever, and that's okay, as long as they're still drinking. Another question is, if my child has a cold or viral symptoms, can I still send them to school or daycare? If your child has fever and new viral symptoms, like runny nose, cough, sore throat, it's best for them to stay home. Once they have been improving for 24 hours and no longer have fever, they could return to school or daycare. Masking is one of the ways that we can still help protect ourselves and others. It is recommended to wear a well-fitting mask for 10 days from the onset of their symptoms. The final question is, when should I take my child for care at either their family doctor, COPC, or the emergency department? Any baby with a fever, so a temperature above 38 degrees Celsius or 100.4 Fahrenheit, should be seen. A fever that lasts for more than 5 days should come to have an assessment. And any child who's having difficulty breathing or has signs of dehydration with dry lips and mouth, decreased tears, and less than 3 Ps in 24 hours should come to be seen.